Bonsoir à tous, and thank you, Jamie, very much for that kind introduction. I am first and foremost the Member of Parliament for Ottawa Centre, and I'm really excited about this discussion, and I wouldn't miss it. I'm very, very happy that the Ottawa Hospital is holding these discussions today. I'm very grateful to be able to join my friend and colleague, Yasser Naqvi, and to listen from Dr. Kitts about the hospital's vision for the Civic campus. So I have a strong relationship with the Civic campus. All three of my children were born there. And I also paid a visit to the emergency room in a very Ottawa fashion after skating to work on the canal. I had a terrible fall, which was extremely embarrassing, and then ended up at the Civic. I'm sure many of you have shared the same experience. I certainly know how important the Civic campus is to the residents of the downtown core and also beyond. Having a hospital close by, easily accessible on public transit, it makes our community healthier, and it makes our community stronger. Il est essentiel pour notre communauté d'avoir un hôpital près de chez nous et facilement accessible en transport en commun. The current Civic campus of the Ottawa Hospital has served our community well for close to 100 years. It is clear that it needs to be modernized to meet the needs of Ottawa's growing population. As a Member of Parliament for Ottawa Centre, I've spoken with a lot of people about this hospital. As many of you know, I knocked on a lot of doors to be here. And what I've heard is this is an extremely important issue for people in our community, but also people in all of Eastern Ontario and also in Gatineau. That's why public consultation engagement is a crucial part of this process. This is your hospital, so your voice needs to be heard, and you need the chance to shape the plans for the new Civic campus. That's why I'm glad to see so many of you have the opportunity to come here to learn more about this exciting vision for the hospital, and also to express your views and what you are looking for from a modernized hospital. You will hear from Dr. Kitts tonight as he highlights the Ottawa Hospital's vision. It will give us a lot to consider, and I'm very excited to listen as well. We've had many good conversations and are working very closely together. Going forward, as Ottawa Centre's representative, I commit to working with my colleagues in the federal, provincial, and municipal governments, as well as the Ottawa Hospital and the community, to make sure the downtown Ottawa gets the hospital it deserves. As you may know, the federal government is currently working with the Ottawa Hospital on the location of the modernized Civic campus that makes sense for the hospital, the government, and the broader community. I know my friend and colleague Yasser Naqvi, who will say a few words in a moment, shares my goal to keep the highest quality healthcare in downtown Ottawa. It's really great to have different levels of government working so closely together. Merci beaucoup. J'écouterai avec grand intérêt ce que l'hôpital a à dire et que les membres de notre communauté partagent avec nous ce soir. Et à l'avenir, je m'engage à continuer à être à l'écoute des résidents d'Ottawa Centre afin de nous assurer les services de santé et de soins que nous méritons. Merci.
Thank you, Catherine, for those words of support, and we look forward to working with you in the months to come. Catherine mentioned three of her children were born at the Civic Hospital, and I'd like to firstly congratulate Yasser. I believe he had a second child born there just 2 weeks ago, so two, is there a third one? So, without further ado, I invite Yasser Naqvi, a Provincial Member of Parliament, to address the group.
So if I sound a little rusty, it's because I've been away for the last 2 weeks, because Jamie mentioned my daughter, Eliana, was born 2 weeks ago at the Civic. So first-hand knowledge of, first of all, what an incredible institution the Ottawa Hospital is in our community. And I think that's something we all should be very, very proud of. The medical staff, the administrative staff, everyone was superb. So Jamie and Jack, through you, a big thank you from my family to the Ottawa Hospital for the arrival of our baby daughter, Eliana. I want to thank the Ottawa Hospital, and I want to thank the entire community. that is here in person or have been involved in this very important discussion and will continue to be involved in this very important discussion around the future of the Ottawa Hospital Civic campus. This is a very important discussion that we are embarking on because this hospital will serve our community for many more decades to come. This is, I mean, imagine this, the current site has been there for almost 100 years. You can imagine how much the new site and what kind of care and services that will provide to our community. And that's why it's important that we have this very important public discussion to ensure that we as a community are working together along with our hospital and the other levels of government together. I do want to acknowledge again our two city councilors, Jeff Leeper and Riley Brockington, who are here because those two wards are very much impacted by the Civic Hospital and they have been quite engaged. So thank you very much for both of you, your engagement. I also want to introduce Chantal Leclerc, who is the Chief Executive Officer of the Champlain Local Health Integration Network, in short known as LIN. Chantal, if you can just please wave. LIN is a very important provincial organization which its role is to coordinate health services and sort of spearhead the regional planning around present and future health services in our Champlain region. So they are a very important instrumental part as an agency of the Ministry of Health and Long-Term Care at a local, regional level, working very closely with Ottawa Hospital, that the services that are required today, tomorrow, and decades to come, they're all well coordinated and there is evidence-based planning that's involved. I also wanted to give you quickly a bit of a highlight around a very robust Ministry of Health planning process in order to even approve a new hospital or a redevelopment for a hospital. As you can all imagine, that planning for a major hospital redevelopment project is a complex and collaborative effort that takes multiple years to take place. Each step of the process has mandated public consultation and engagement aspects built into it. This to say that this is not going to be the first and the last consultation. This is the beginning of a very important process where public will be engaged and will be consulted in the entire redevelopment process. As you can imagine, in a planning process like this, there are quite a few common planning challenges that are dealt with in the development of the plans by the health service providers, in this case, the Ottawa Hospital, such as securing a suitable site, a conversation we've been having, example, location, the size, and land acquisition costs, which is an important discussion that takes place. Rationalization of services between neighboring health service providers to avoid any duplication and over-planning. Part of the role for Ottawa Hospital and LIN is to work together to make sure that services are not being duplicated to what's been provided at the general campus or MOFO or Queensway Carleton, even as far as looking at Cornwall or Carleton Place, because you are developing a regional plan, just not a plan for one particular area. And of course, the ability of the health service provider to meet the share of project costs as well. Experience with other major hospital projects, most recently the new Humber River Hospital and the new Oakville Trafalgar Memorial Hospital identified that planning from concept to occupancy may take up to 10 or more years to complete. This is just to tell you that we are embarking on a very early part of the process. And that's why the conversations we're starting to have right now are very important, because there are many other more steps to come. My commitment to the community, and the commitment that I know Catherine McKenna shares, our city councilors share, and I'm confident the hospital shares as well, is that one, we have a future civic campus in the core of the city. That's something I've heard from my constituents, all of us, again and again. We're very lucky and fortunate in our city that our downtown population continues to increase. You can see by all the cranes and the condo towers that are going up. If you look at the demographic analysis today, and that's coming ahead, you will also see that the age is maturing as well. A lot of older adults who are moving into the downtown core. That only tells you that there will be more need for healthcare services in the core in future years, and we need to be very mindful of that as we develop the plans for our future hospital. The second commitment that I have to the community is that we will engage in an open and transparent process. We will make sure that there's community engagement at every stage of the process, that there's a two-way conversation so that we get the hospital right. As I said earlier, this is not just a hospital we're building for today or tomorrow. This is a hospital that is going to serve us for decades to come, and we need to make sure that we all have input in that dialogue. So once again, thank you all for being here. Thank you all for being such engaged members of our community. And I very much look forward, on behalf of the provincial government and most importantly, on behalf of our community in Ottawa Centre, working along with you in the hospital and making sure that we have a 21st century world-class healthcare facility right in the core of our city. Thank you.
And again, thank you, Yasser, for those words of support, and we look forward to working with you in future months and years ahead. As well as being chair of the Ottawa Hospital Board of Directors, the Board of Governors, I'm also vice chair of the Ontario Hospital Association. And in my travels around Ontario and across the country, the name Jack Kiss is often mentioned in a very flattering way. I've had the pleasure of working with Jack for the last 4 years on the board, and there is no one that I could speak to who would be more qualified and more of a visionary to lead us in the building of this exciting new project. And to keep, before he speaks, to keep with the theme of babies, Catherine had 3 babies at the Civic, and Yasser and his wife had 2. Jack became the proud grandfather of a baby born at the Civic last week. So if you stick around later, he'll show you the pictures. Jack.
Bonjour à tous et merci d'être venu ce soir. I'm really excited about the story we have to share with you this evening. We want to tell you about a great city building project that we have been anticipating for years. And with your help, we will soon begin the journey to create the best healthcare facility in all of Canada. Ensemble, nous commençons un projet formidable pour donner les meilleurs soins de santé au Canada. But first, I do want to thank Catherine McKenna and Yasser Naqvi for being here with us this evening and for their support in bringing our vision closer to a reality. Mayor Watson had to send his apologies, but I want to acknowledge his support for what I believe is the most important city building initiative that our community is undertaking. A special thanks to our members of Parliament, members of provincial Parliament, city councillors, public servants, and business leaders for being with us this evening. I would be remiss if I didn't recognize the support of my board chair, Jamie McCracken, and all the members of the Ottawa Hospital Foundation Board who are here this evening. Members of the Ottawa Hospital Research Institute Board and the Ottawa Heart Institute Board are all here as well, so thank you for your endless support. The leadership from the Champlain Lynn, you've met Chantal Leclerc, and the Heart Institute, and our health partners from across the Lynn have been highly supportive, and I want to thank all of them who are here tonight. And of course, none of this would be possible if we didn't have, in my unbiased view, the best hospital staff in the entire country. Thank you to our doctors, nurses, other health professionals, researchers, and all the support staff for taking the time to be here. And finally, a special thanks to all of you, our community members, for coming here this evening. I know that everyone has to juggle work, family, and private life. So once more, thank you all for making the time for us. Ce soir, nous répondons à beaucoup de vos questions. We will answer many of your questions. We'll address some of your concerns and hopefully begin to build the partnership and trust that is essential to creating one of the finest 21st century healthcare facilities in all of Canada together. This is our first public information session, and I anticipate that we may not get through all your questions this evening. We will soon follow with a more robust consultation program. In the meantime, you can go to our website to ask questions and receive updates. Now, before I take you through the exciting vision we have for our new hospital, let me begin with an apology. First, I am sorry that it has taken so long to get to this event. I could offer you a long list of reasons why, but I won't. I will, however, thank you for your patience. Second, I want to apologize for allowing the issue of where we build this great new hospital to almost overshadow the far more important question of what we are going to create together. Where we build is really important because at the Civic, we treat the most acute patients in the National Capital Region, where minutes really do matter. So we must build our new Civic where it makes the most sense for the most patients, on a site that is accessible to highways and transit, in the heart of Ottawa, and where a great hospital and a health village can flourish. I am sensitive to the concerns that have been raised about the experimental farm, and I assure you that we are working with the federal government and the city to address those concerns. I'll be pleased to answer any questions you may have about the potential sites during our Q&As that follow. But tonight, I really want to focus on why we need a new Civic campus and how our stakeholders and experts in 2008 identified the site, the farm, as the highest rated location for the new campus. And I also want to touch on the current review to assess other potential sites in our city core. So let me begin where we are today. Today we work out of an aging, early 20th century hospital. A hospital built to earlier standards, very different standards, one that no longer allows us to be the best we can be and to deliver comprehensive and integrated health care. A 21st century facility will enable us to deliver safe patient care and do it more efficiently. It will also serve as a hub for an integrated network of health and healthcare services. It is really the heart of the modern approach to healthcare in the 21st century. Let me try to sketch an outline of our vision. You will have the best care in the comfort of a private room filled with natural light. Every patient will have their own bathroom, which is critical for reducing hospital-acquired infections and promoting recovery with your family and friends in the privacy of your own room. Isolation rooms, modern materials, flexible floor layouts, and monitoring systems will help us defeat superbugs and repel viruses and drug-resistant bacteria. Diagnosis and surgery will be done in tandem in the same operating room suite. We will save precious minutes treating strokes, heart attacks, and major trauma. Every minute saved can mean the difference between a good outcome and a permanent disability, even death. Your new hospital will be fully digitized. You, your family, your caregiver will have real-time access to your up-to-date health records from anywhere in the world. We will continue to be a center of excellence for groundbreaking research and discoveries that lead to better treatment protocols that will benefit our patients first, then the patients across the country and around the world. Today, we have a very committed and caring staff, and I hope you got to meet many of them this evening. They work hard to ensure that you receive the best care available today. But they do it in a facility that was first opened nearly a century ago. Our aging buildings need constant renovation and repair. And despite this ongoing patchwork, we have parts of the hospital that must be closed permanently. They're literally too unsafe to use. And at only 23 acres, our facilities are squeezed onto a site that is just too small. Our emergency helipad is situated across Carling Avenue. When a helicopter lands, our most critically ill patients have to be transferred from the helicopter to an ambulance. The paramedic has a key that allows them to turn the traffic light to green so that the ambulance can safely cross Carling Avenue and then drive a few hundred feet to the emergency department on the main floor of the Civic. From the emergency room, those who need an MRI must go across the hospital and up a floor to the first floor. And then, if required, if they need critical care, they go up another floor to the intensive care unit, and if they need to go to the OR, it's over on the third floor. All of this in one of Canada's largest trauma and acute care centers, where minutes really matter. Today, academic hospitals, university hospitals, like the Ottawa Hospital, face stiff competition in attracting and retaining the best talent in the country. The best doctors and researchers and the largest share of research dollars flow to leading-edge facilities. Our researchers today struggle with space and equipment to meet international standards. And just like any other healthcare facility in the 21st century, infection control is a battle we wage daily. Now, I want to be clear. Our staff are exceptional at dealing with their aging hospital. Our performance, our quality for door-to-treatment times are as good or better than other hospitals in the country. But imagine how frustrating it is for our professionals to know that with a modern facility, they may save more lives and limit suffering. The core of our vision is really simple. The best facilities, the best professionals, delivering the best care, not just on opening day, but for a generation. I am really excited about this because if you look back, this might be a once-in-a-century opportunity to create the future of healthcare in the National Capital Region and the Champlain-Lynn, and we do that together. Today, the Ottawa Hospital serves a population of 1.3 million people across dozens of communities in Eastern Ontario. And we provide care for more than 1 million patient visits at the hospital each year. In fact, we serve more patients and their families than any other hospital in Canada today. And the demand for the best possible care is growing really fast. Our aging population will put tremendous strain on our health system, and it's already started. We will simply not be able to cope without newer, safer, and more efficient facilities to deliver quality health care. We are proud of what we achieved today in a facility, parts of which date back to the Great Fire on Parliament Hill at the turn of the last century. But we want to continue to be the best we can be, a leader in patient care, in research and discovery. So we began our planning almost a decade ago. We created a master plan for 2020 and beyond. In 2006-07, we convened a planning committee made up of the region's top healthcare leaders, medical professionals, and community leaders to help us with our planning. The committee recommended that the Ottawa Hospital of the Future should continue to be a 3-site model. The Riverside campus will expand its ambulatory programs on site. The general campus, which is 40 years old, will expand existing services, including a major cancer center, thoracic surgery, transplants, high-risk obstetrics, and the Eye Institute. And the Civic campus will continue to be the major trauma center and acute care center for the Champlain Lynn, and will deliver acute care in neurosciences, vascular surgery, and cardiac care, co-located with the Heart Institute. Many of you may recall that in the mid-90s, prior to the Health System Restructuring Commission's merger, health experts recommended demolition of the Civic campus. It was deemed to be too old to restore and rebuild, and that was 20 years ago. You won't be surprised then to learn that in 2007-08, the Planning Committee did not recommend rebuilding the Civic campus on site. It would create unsafe conditions for patients and disrupt our staff. It would take more than 20 years to complete, and all of this at an additional cost of about $800 million. The Planning Committee then engaged a panel of key stakeholders and experts to identify potential sites for a new Civic and evaluate them against a list of 12 criteria to determine which sites would best meet the healthcare needs of the community, the citizens of Ottawa, in the 21st century. We needed 50 to 60 acres. We needed to be close to the city center. Our patients and ambulances needed multiple access points, and we needed to be close to the Queensway and public transit. After a comprehensive review that took over a year, the Carling Avenue site scored the highest in the city core. We reported our panel's recommendations to the federal government in 2008. Of the dozen sites that we assessed, 11 were federally owned. So we needed their agreement to secure a site, and we were informed that our request would be considered. In 2012-13, we again asked the federal government for an update, and we were told that a process was underway, but it would take some time before a decision was made. We were subsequently asked to provide information to government to help inform their decision on the land. And in November 2014, we all learned that the site across the street from our existing site would be transferred to the NCC and leased to the Ottawa Hospital for a new Civic campus. We were delighted because with a site, we could now begin engaging our community on design and vision for that 21st century hospital. However, we then learned that the process for the land transfer may take up to a year. And towards the end of that process, we learned that the location of the hospital was a concern. Because of this, and the fact that our site selection was actually 8 years ago, the federal government has undertaken a review of potential sites to determine if any changes have occurred and whether those changes might influence site selection today. We are working closely with the federal government and the city to provide more up-to-date information on 4 potential sites in the city core. The Sir John Carling parcel, which is at the northeast corner of the experimental farm, Tunney's pasture, the original parcel of land on the northwest corner of the farm, and a modified version of the original parcel. As we will be long-term tenants of the federal government, we are working diligently with them to finalize a site. Our overarching goal has not changed. We remain committed to provide the best healthcare possible to the citizens of the National Capital Region, not only for this generation, but for generations to come. Now, I want to finish with the what. What our new campus in the heart of Ottawa might look like. Hospitals of tomorrow will be built for flexibility in design. And I'm not referring only to the facility. Together, we will plan how best to integrate the hospital into our community and how to connect to our health partners in long-term care, palliative care, and in the growing home care and community networks. Our planning process will ensure that we work closely with our neighborhood residents, businesses, and other stakeholders. We will deliver community benefits tailored to your goals. It will be a design that is respectful of and in sync with the community, built to human scale and integrated with the natural landscape, not a tower and a parking lot. A design that is at the heart of a neighborhood, not glass and steel standing in isolation. It will be linked by walking and cycling paths, connected to healing gardens and therapeutic gardening centers with quiet places for reflection. And the 21st Century Hospital will be future-friendly, meeting the highest environmental standards. Imagine a facility designed to deliver wellness and the speed recovery in buildings full of natural light and blended with its community. A 21st Century Hospital is about leading-edge patient care and cutting-edge technology, research, and discovery. But it's also about neighborhood-scale urban planning. And it's part of a trend that promotes healthy buildings and healthy communities. And all of you will be able to provide fresh ideas into what our 21st Century Hospital will be, so that everyone, patients, visitors, neighbors, and residents of the National Capital Region will find benefits and comfort in their new hospital that has been designed to be an integral part of our city's fabric. Tonight is the first in what will be a very lengthy community discussion. This will be a long journey together, but I hope that you are beginning to get almost as excited about your role in helping us achieve our vision. Let me leave you with this closing thought. We are building a new hospital, not only for our generation, but for our children and their children. As Jamie said, several days ago at the Civic, I became a grandpa for the first time. This incredible milestone in my life and that of my family put this new hospital into a very real and personal perspective. The next generation is counting on us. Merci encore une fois pour votre participation, and I look forward to working with you. Thank you.